Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Today, what I want to talk about is the chiropractor the expert for the traumatic brain injury? So today in the injury space, we have this thing called a concussion, which is a traumatic brain injury, and it often goes hand in hand with a spinal injury. Now, the chiropractic profession, and I shouldn't say the chiropractic profession, what I should say is really good chiropractors are in line to possibly be the best treatment providers for this condition because it's inherent with taking an auto accident, for example. Today we know that in auto accidents, there's basically a lot of traumatic brain injuries. So 14.3% of all traumatic brain injuries are caused in auto accidents. 10.7% are caused by falls. 15.5% are patients struck by something. 40.5% they're found by falls. So every 21 seconds in the United States, someone sustains a traumatic brain injury, and every 7 seconds, someone sustains an injury in an auto collision. So they often go hand in hand. There are some experts today, myself included, that say it is very unlikely that you would have a traumatic brain injury without a cervical injury. They go hand in hand. They're almost inherent. Inherent means that you can't have one without the other. All right. Now, who is the best at working up a spinal injury? Well, that's not the middle of the pack. Chiropractor is not the best. The best is what we say is at the front of the bell curve. The doctors that really understand the injuries, and the doctors that really understand these injuries know that a cervical evaluation's got to be performed. They know that in the traumatic brain injury space, in the concussion training space, when a person has a concussion, they're looking for 6 clinical trajectory patterns, 6 clinical paths that the patient may go down. And that's vision problems, balance problems, cognitive problems, anxiety or mood problems, headache problems, and cervical problems. So everyone that's taught in the country is taught these 6 things are associated with a traumatic brain injury. Now, what most people who are taught with a concussion or a traumatic brain injury are never taught what the cervical profile is. They're never taught what this cervical trajectory pattern is. And it's an upper cervical ligament condition. And that upper cervical ligament condition, we can call it an atlantoaxial instability. We can call it a cervical cranial syndrome. We can call it a whiplash-associated disorder. Okay, atlantoaxial instability is a condition that causes excessive movement between the first and second vertebra of the upper spine. It may be caused by a number of factors, such as congenital conditions, such as Down syndrome. It can be caused by inflammatory diseases like rheumatoid arthritis, but it also can be caused by trauma. Cervical cranial syndrome is a group of symptoms caused by an injury, disease, or degeneration to the next vertebra. Okay, well, that's also an injury state. Whiplash-associated disorder is a term used to describe a wide range of symptoms that can occur after the neck is injured in an acceleration, deceleration incident, such as a car crash. Okay, so what is post-concussive syndrome? Well, post-concussive syndrome is when you have a traumatic brain injury and the symptoms last for 3 months or more. But when we look at the symptoms, if I take a look at atlantoaxial instability, it can cause neck stiffness, headaches, dizziness, vertigo, paresthesias in the face, fatigue, difficulty sleeping, irritability, tinnitus, nausea, vomiting, visual disturbances, cognitive impairment, anxiety, lightheadedness, memory problems, ear pain, crepitation, balance difficulty, drop attacks, dysphagia, speech disturbances, migraines. Okay, if I look at craniocervical syndrome, remember that's an injury to a group of symptoms caused by an injury, disease, or degeneration to the next vertebra. Craniocervical syndrome, neck stiffness, headaches, dizziness, vertigo, paresthesias, fatigue, difficulty sleeping, tinnitus, nausea, vomiting, visual disturbances, cognitive impairment, anxiety, lightheadedness, memory problems, ear pain, crepitation, balance difficulty, drop attacks, dysphagia, migraines. Whiplash-associated disorder, the same. The biggest thing that anyone has to understand is that if you look at those 6 clinical profiles, okay, the cervical can cause all of the other symptoms, but the other profiles cannot cause a cervical condition. So the cervical spine is senior. This is probably the biggest area today, and I think the biggest area for really sharp injury doctors that are chiropractors to pick up on this particular area and to work with neurologists, to work with neuropsychs, to work with the various people that are in this space to actually get these patients better through the very natural means of chiropractic care, right? The chiropractor on these cases should be the beginning, the middle, and the end as far as treatment on these cases, because this condition is, the cervical condition is the most important condition. And it also, if you look at it from an x-ray point of view, so we have this thing called the National Emergency X-ray Utilization Study, Nexus. Almost all x-ray guidelines are based on Nexus. Nexus says, hey, if a patient comes in and they got midline spinal tenderness present, you got to x-ray them. It says if they got a painful, distracting injury present, you got to x-ray them. Painful, distracting injury can be, hey, I lost my finger, but I also damaged my shoulder, but I'm screaming so bad about my finger that it's distracting me from knowing anything about my shoulder. Or I could have a bone or a ligament injury are also painful, distracting injuries. Intoxication present, that's basically for, things like emergency rooms. Focal neurologic deficits present. What does that mean? That means a problem with the nerve, a problem with the cord, or a problem with the brain. Encephalopathy, altered level of consciousness. You should x-ray. So this all ties together, right? Because what are you x-raying for? You're x-raying for the cervical profile of a traumatic brain injury. And so this particular area, I think, is the easiest area for doctors to really focus on, because anybody that has these symptoms, and these symptoms are chronic, needs to actually have somebody who understands the cervical profile, the cervical ligament injury. Right? Now, there's a lot of wannabes out there. There's a lot of, I think, doctors out there that think they understand the cervical ligament injury. And that's, again, what we do in the Smart Injury Doctors program is put doctors into the front of the bell curve. These doctors understand. They understand how to work them up. They understand how to document them, and they understand how to treat them and get very good results with them, so the patients don't have to have permanent symptoms. Now, what I mean by that is the condition itself is permanent, but the symptoms don't have to be permanent. Right? They don't have to be ongoing, have it all the time, every day. That doesn't have to happen with these types of injuries, right? Not at all. Not at all. And for the really good doctors, this is a prime area, because the same thing, if you have post-concussive syndrome, right, the symptoms of these crossover symptoms that are hanging in there for over 3 months, that's very common with a cervical ligament injury of the upper cervical spine. That's not uncommon. And patients need to be stabilized, and then they need to be supported. And that support can vary depending on the severity of the injury, depending on the pre-existing conditions that the patient had, depending on a lot of other factors. That can be different. So that's what we're looking at. That, doctors, is the easiest. Now, if you're not understanding what I'm saying on this podcast, please look us up at smartinjurydoctors.com. Call me. You go out to our website, you can schedule a visit with me. Schedule a visit with me. Get understanding. Here's what I found. What I found is a very interesting thing. And that very interesting thing is that if you look at the injury market, I don't care what, you can look at physical therapy, you can look at chiropractic, you can look at medical doctors, it doesn't matter. There's a bell curve. You put the whole profession under the bell curve. So if we took all the injury doctors that are chiropractors, okay, in the middle of the bell curve is average. That's 50% of the doctors. That's average. Now, average, another word for average, I knew that I was average at one point, and I wanted to change that because I knew average meant mediocre. And I didn't want to be mediocre. I looked at it and said, everything else that I've done, sports that I've done, any other types of activities, every job I ever did, I didn't want to be average. I wanted to be the best. And I don't care if it was being a hall or a mall guard, security guard. I wanted to be the best one that they'd ever had. Okay, so in the injury space, you have 25% are just bad. They're at the back end of the bell curve. They're just bad, right? You have 25%, 50% that are mediocre. So 75% of the injury providers are average to bad, right? Now, it's not really fair to say that. Let's say 50% are average to bad and 50% are average to good. They're on the front side of that bell curve. But you want to be at the top 25%, and realistically, you want to be in the top 10% because that's where the top 25%, that's the best. But the masters, the pros, the ones that you would want to have treating you, they're the masters. They're in the top 10%, top 5%, top 2%. And here's the thing. The difference between the masters and people that are not masters, the doctors that are not masters, the bad, they complain. They just complain. They complain up and down about chiropractic, how chiropractic is not good, if we're talking chiropractic. The middle of the bell curve, the 50%, they self-invalidate. They take themselves out of the market. It's an interesting thing. The best and the masters, they train. They educate. They invest. They invest in themselves. Because this particular space, in this case, is so wide open. It's so wide open for the taking. And it makes sense. You have to have great knowledge of the injuries themselves and how you work them up. That inherently causes you to document better. And then you have to have a really good idea of what you're doing to get these conditions to improve. And if you can do that, the market is wide open for you. Doctors, if something that I said today resonates, this traumatic brain injury space in the ligament injury space with the spine or the spinal injury space is absolutely wide open. All you have to do is take it. It's absolutely wide open. It's the easiest space I know of to take. So if something's resonating with you, great. If you want to know more about this, again, go to www.smartinjurydoctors.com and schedule a call with me. Or call us at 800-940-6513. Do the same thing. Schedule a call with me. Doctors, as always, I hope something that I said today resonated with you. I hope it helps you in some way or to look at something or gives you a different direction maybe to take. And I very much so appreciate what you do every day for a living, the people that you help, and I look forward to delivering more content to you on the next podcast.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.